Welcome to this new episode of Pablo Baglioni's podcast. First, I'd like to share that last month we held our first Cardio and Tennis Day Symposium, where clinical and interventional cardiologists joined for talks and a doubles tennis tournament. Everyone had a great time, especially the winning pair. Today, we'll discuss the 4-year durability of the Myval valve, an article presented in Eurointervention. I have no conflicts of interest to disclose. As you know, the Myval valve is currently the only alternative to Edwards Sapiens. Last year, they conducted a study showing the valve's non-inferiority compared to Sapiens and Evolue. Valve durability is crucial as we're now treating younger, lower-risk patients with these procedures. Well, the initial results of this device were very promising at first, and this study aims to evaluate and report on its 4-year durability according to the parameters defined by BARC 3. As I mentioned earlier, the primary endpoints of this study were hemodynamic valve deterioration, bioprosthetic valve regurgitation, and valve patient mismatch. Stage 2 valve hemodynamic deterioration was defined as an increase in mean transvalvular gradient over 10 mmHg, resulting in a mean gradient above 20, or an increase of more than 1 grade of intraprosthetic aortic regurgitation, leading to moderate aortic insufficiency. Stage 3 deterioration was marked by a mean transvalvular gradient rise above 20, leading to a mean gradient over 30 mmHg, or a 2-degree increase in prosthetic aortic regurgitation, resulting in severe aortic insufficiency. Bioprosthetic valve regurgitation was classified using 3 criteria. First, any bioprosthetic valve dysfunction with new or worsening symptoms or irreversible stage 3 dysfunction. The second criterion is valve deterioration requiring aortic valve intervention. And the third is valve-related death. Mismatch was defined using body mass index adjusted thresholds according to BARC 3 guidelines. This study enrolled 366 patients who completed 4-year follow-up or until death after TAVI implantation. The mean age was 75 years, 32% were women, and the average Euroscore was 4.2. 98.9% of procedures were transfemoral, with predilation used in only 7.9% of patients. The mean aortic valve gradient was 10 mmHg with a valve area of 1.7 square centimeters. At 30 days, 5.5% had moderate aortic regurgitation and only 0.5% had severe regurgitation. At 4 years, 80% of patients were alive and 98.5% were stroke-free. Valve-related rehospitalization was only 1.6%. Severe mismatch was around 2%, maintaining the same EF, and we can say that.
I'm Dr. Ignacio Amat-Santos from Valladolid Clinical Hospital in Spain. Dr. Baglioni asked me to discuss our recently published article in Eurointervention. It's about the 4-year durability of the Mitra prosthesis. This is the first long-term study, though retrospective, with strict echocardiographic follow-up. At 4 years, we found high survival rates over 80% in 366 of 400 plus patients with full follow-up. Low hemodynamic dysfunction, 2% mismatch, and good gradients at 4-year follow-up. Regarding BVF, bioprosthetic valve failure, only grade 1 has been found, causing symptoms in 3.3% of cases. As for valve hemodynamic deterioration, severe grade was found in just 0.7% of patients, with no reoperations needed. At 4-year follow-up, severe insufficiency rate was 1.4%, slightly higher than the partner 3, mainly linked to extra large sizes. Overall, these promising results suggest the valve is safe at medium term after 4 years of follow-up. Thank you for inviting me to discuss our study results. Well, thank you very much for your participation, Dr. Amat-Santos. We'll see you in the next episode.